When our current CEO came to join the practice, one of the first things I said to him was, well, I do quality of care, not quantity of care.
My nurses are wonderful with patient care. They know the needs of these patients, and they see that it gets done.
The nurses are so nice, they really are. And so many times I've been in there with a problem, and they'll say, you know what, that just happened to me. I had so-and-so and so-and-so, and they can relate.
I've been a patient here now for 6 or 7 years, and it was a transition that I made from another practice here in town because I felt as though I would get a little something more.
We try to make a visit at the physician's office as pleasant as possible, try to have some fun, try to laugh and joke.
Laughing is good for you, and I think that the doctors know that, and they certainly do add to it.
It's a fun atmosphere to work in, knowing that we're all sort of working for the common goal, which is really to make sure patients have a good experience and leave healthier than when they came in.
Just a lot about continuity of care and quality care, and keeping that communication line going is just really important for the patient's safety and for their health benefits along the road.
I like Dr. Goldie, number one, because he's just a nice person. Plus, he doesn't talk down to me, and he becomes a friend who's a doctor, fortunately.
What sets the Family Health Center apart is their attentiveness, their availability, and they fill the role of a primary health physician as well as anyone could expect.
I've never been disappointed with the level of care, knowing that their expertise was on top of whatever I needed. My last visit with Dr. Burris involved discussions about real changes in men's health care that are on the cutting edge right now. And he was interested as much in my opinion about it as I was in his. So I always leave feeling as though we've covered everything and I'm being taken care of.
We are always looking on how to improve our practice and improve the service that we provide to our patients, and to make this a great place to come and be a patient, a great place to work.
They are the best group of doctors and nurses that you could ever possibly want. They're very comfortable to be around. You feel like you can tell them anything, the doctor. You know how sometimes you go into the doctor's office and you're scared to death, your blood pressure's out the roof and all this. Well, you don't get that at all here because they all work together for your good.
What makes Asheville Family Health Center tick is that the physicians really like each other. You know, we are here together as a team.
I think that the healthcare team is the foundation of patient-centered care.
It takes every single one of us to make the whole wheel turn, from the people that talk to the patients on the phone, setting the appointments, to those that register them at the front desk, to the nurses, to the doctors, to the lab techs, to the x-ray technicians. It takes all of them. And then once all of that happens, it still has to go through the billing office, and all that has to run smoothly. And it's just a really well-oiled, functioning machine.
You know, basically it involves everybody, from the insurance company to the pharmacist, to the physical therapist, to the specialist, and it's about communication, and it's about forwarding information, and it's about teamwork.
The doctor may be a team leader in that process, but a team approach is absolutely essential.
There's an interest in my health, and it doesn't end with the staff, but it encompasses everyone involved, including those that take my blood, including those that take my blood pressure, and those that prepare me for my EKG or whatever test I might have. Everyone is interested in my well-being, and I have that feeling.